welcome in Opioids Intervention in Case of Overdose. My name is Jean-Claire Mondrelet. I'm a registered nurse in Institut Universitaire de Santé Mentale de Québec, the big psychiatric hospital in Quebec City. And I will be with you for this short and simple presentation on a problem that will touch you one day. If it's not next week, it will be in 6 months, 1 year, 2 years, 5 years. You don't know, but take care, it comes. And it's important to be ready. The objectives of the presentations are very simple. The second, recognize the signs and symptoms of an opioid overdose. The third, intervene adequately in case of overdose. And the first, have fun along this presentation, because when we have fun, when it's pleasant, we learn much more. And I'm sure you will have fun just by hearing my very strong Quebec accent. You know that English is not my first language, but I will do my best to give something interesting. The plan of the presentation is very simple: opioids, state of the situation; overdose, clinical signs, symptoms, and interventions; and we finish with thanks. This is a simplified classification of drugs in stimulants, depressants, and hallucinogens. You see that opioids are very pure depressants. Opioids slow down all the functions of the body. The difference between opioids and opiates is very simple. Opioids, in general, are substances that act on opioid receptors to produce morphine-like effects. Medically, they are primarily used for pain relief. Opiates are substances properly limited to the natural alkaloid found in the resin of the opium poppy, although some include semi-synthetic derivatives. Opioid, a more modern term, is used to designate all substances, both natural and synthetic, that bind to opioid receptors in the brain, including antagonists, including naloxone. Naloxone is an opioid. Opioids act by binding to opioid receptors, which are found principally in the central and peripheral nervous system and in the gastrointestinal tract. We are talking a lot about opioids now because there's new drugs and trends in new drugs, and especially very pure and more powerful drugs about synthetic hallucinogens, very good and pure methamphetamine. But now we find on the black market synthetic opiates that are very powerful, especially fentanyl, carfentanil, methylfentanyl, butylfentanyl, all the derivative of the fentanyl. And very powerful. You can see on the slide how fentanyl is very powerful compared to other opioids. And so powerful that just a very small amount of fentanyl, a teeny amount of carfentanil can kill somebody. You see compared to a pure dose of heroin. You see here a fatal dose of fentanyl on a penny. It's only 2 milligrams, very small. And about carfentanil, but it's teeny like a grain of salt. And unfortunately, more and more we find fentanyl on the black market and laced to drugs that can be used from the black market. And we can say, especially in heroin, we can find in cocaine, and it's laced also with pills of speed on methamphetamine. You see that's only 1.7% around pills of methamphetamine laced with fentanyl. Okay, this is not a lot, but when this is that bag of methamphetamine that comes in your community of 300 or 500 persons, then you have to face a few overdoses. We can find fentanyl also in cutting agents, unfortunately, and the reason is very simple. Fentanyl is very easy to produce, and now forget the small laboratory in shacks or in the countrysides, very far from city. Now all these new drugs, fentanyl, speeds, synthetic cannabinoid, are produced in big factory in China, North Korea, and in Mexico. And for gangs, this is perfect for them. They have roads to sell it and to for the distribution, and more they make money, more they can protect their roads and the market, and more they protect the market, more they make money. And it's very easy to find fentanyl and other kind of drugs, and that's why a lot of drugs are seized by police, especially in our airport and borders. And unfortunately, we can receive by mail, and it's very easy on the dark web, and to ask to not to request but to command drugs and to pay these drugs by bitcoins. And because fentanyl, you can have a very small amount of fentanyl, a few grams, sent by mail, but it arrives like a letter. And for that reason, because fentanyl is more and more present on the market, but there's more and more deaths related to overdose of opioids. And unfortunately, we can find stories like that guy of 21 years old who died after one or two pills of laced with fentanyl, and he died the day after. The mother posted the picture, this photo, on the Facebook page. Now, how to be ready and to respond? The most important is to recognize the signs of overdose of opioid, and the signs are very easy to recognize. All the body is slowing down, okay? Trouble walking or talking, won't wake up, difficulty breathing, gurgling sound, or unusual snoring. The skin is cold, clammy. The lips or nails are gray, purple, or blue. The pupils are very teeny. The pupils are in miosis. The treatment of choice is always naloxone. The most important, for sure, when you find a person with an overdose of opioid, it's to maintaining the airway open, and breathing is the first priority, and then naloxone. Sometimes intubation, but only in a big emergency. Never forget, if IV access is not immediately available to administrate naloxone, you go intramuscular, subcutaneous, or intranasal administration. This is also effective with the same bottle of naloxone. Refer to the protocol of your institution. You have some posters. This is the government of Ontario that make a poster about the opioid overdose and how to respond. You can find a lot of these kind of posters on the web. This is all the same. Is there contraindication about naloxone? Only one, if the patient is hypersensitive to naloxone and to Narcan, and this is very rare. And you have to remember, there's no drug interactions with naloxone. The reason is very simple. Naloxone is an opioid that does only one thing. Okay? Naloxone has a stronger affinity to the opioid receptor and stronger than the other opioid drugs. So naloxone knocks the opioids off the receptors for a short time. This allows the person to breathe again and to reverse the overdose. And if after one dose it's not efficient enough, a second or third dose can be given if there's no response within 2 minutes. 2 minutes, this is very short. Almost all patients respond to 3 doses. If they don't respond after 3 doses, the possibility is the patient's condition is unlikely due to an opioid overdose, or this is due to a massive opioid overdose or intoxication with synthetic opioid very strong, such as the fentanyl derivative, and it may require higher doses of naloxone, a fourth, a fifth, a sixth dose, a seventh dose of naloxone. And you have to remember, you will never make an overdose of naloxone. Okay, there's no problem to administrate a lot of naloxone. But we have to remember that naloxone has a very short half-life because the duration of the action of naloxone is less than of some opioids. Respiratory depression can recur within several hours of an overdose of methadone. Methadone is a very long-action opioid, or sustained release oxycodone or morphine tablets. This is important. The patient should be observed for a few hours until there is no more naloxone pharmacological activity and no more opioid-related symptoms. We have to keep these patients in front of us or have an eye on them. You see here the peak of action and elimination of naloxone. Look, after 30 minutes, there's the half of the dose is already eliminated. We have to know that for patients who are already addicted or using opioids like methadone or addicted to opioid, naloxone can make an opioid withdrawal. And then the symptoms you see is dysphoric mood, nausea, vomiting, muscle aches, very a lot of pain, very painful, lacrimation, rhinorrhea, pupillary dilatation, piloerection, sweating, warning, fever, insomnia. These symptoms are very easy to recognize. This is opioid withdrawal. There's a lot of poster about that. Usually we give just a little bit of opioid to relieve the symptoms, and also a little bit of benzo like Ativan or lorazepam to help about the anxiety. Congratulations, you now have what you need to intervene effectively. And as of December 2019, all villages were equipped with 2,000 doses of naloxone to maintain 2 cases of opioid overdoses for a period of 48 hours. You have plenty of naloxone with you. This video was produced by Nunavik Regional Board of Health and Social Services with the collaboration of Jonathan Bouchard and Stéphanie Michaud. To know more about opioids and naloxone, a much more detailed clinical video is available with the documents provided. Feel free to watch it when you have time. And thanks for your attention. Have a nice day.